I've been a Wisconsin resident for the vast majority of my life. I went to medical school and undergraduate in University of Wisconsin at Madison. I did my residency at University of Tennessee down in Memphis and then decided to come back home. And I've been living in the Fox Valley for 20 years, growing this practice and love living in this area. So my niche or my subspecialty that I've developed is focused on heartburn and reflux and foregut surgery involving the esophagus and stomach. If somebody came to see me, I'd like to give them an idea of exactly what's going on with them, get to learn how big of an impact it's having and why it's a problem for them. Go through all the lab tests and whether there's x-ray tests or any other testing that we do so they have a very good understanding of exactly what I'm looking at and what I'm using to help make my decisions for them and help interpret whatever those results are so that they can come to a very good understanding of what's going to be the best approach going forward, how it's going to benefit them, what the risks are, so that ultimately I'm not trying to sell them on anything. I'm just being informative so that they can ultimately make the choice themselves. Sometimes people do fine with medications. Other times people are bad enough that they need some type of intervention. And since we started incorporating these more minimally invasive procedures as treatment options, we can really sit down and focus with patients what they're experiencing, how bad is their reflux or their problems that they're having before, and then match a specific surgery that's going to have the best impact for them with the least amount of side effect or risk. But ultimately, there's people that do develop symptoms that they can no longer manage with medication or diet or lifestyle changes. And that's when it starts to impact their quality of life. They're having to compromise things that they do and try to alter their lifestyle in order to manage these disease states. Of course, lifestyle and diet have a role, but at some point, because of this connection between the esophagus and stomach that's designed to hold things in place can wear down with time, just like any other moving part. Sometimes people do need to have some type of surgical or mechanical fix in order to reestablish that barrier. Well, the good news about heartburn or reflux issues is that it can be fixed. I think in the past, people have said, just simply take medications. Now there's these smaller, minimally invasive approaches that have the same impact, but with a significantly lower side effect profile that people I think are much better off having, especially when they're just trying to achieve a quality of life improvement.